So, Jen, tell me about your family.
Well, I am a proud mom of two young men who have a 19-year-old son and a 16-year-old son. They are both in school, and they were both directly impacted in their schooling and their lives by the pandemic and having to isolate. Um, and they both have some disabilities that I need to accommodate, different kinds of disabilities, but they both need supports and help, and needed specific supports and helps during the pandemic also.
Okay, can you share a little bit of what specific, if you're comfortable
Sure.
talking about the specific challenges that you guys have?
Absolutely. So if do you mean related to the pandemic or
No,
during?
their diagnosis or their
Sure. So my older son Sean has a variety of medical needs and also a physical disability. He has cerebral palsy, and he also has some medical needs like epilepsy, and he uses a feeding tube and a wheelchair, and actually has quite a high level of disability. Um, and he also leads a really full life, especially considering his level of need. My younger son, Sam, has some specific issues with attention, with reading social cues, with forming friendships, things like that. And his needs are considerably less than my older son, but he does need some specific supports. He has an IEP, and he has supports at school to help him be successful. So they have very different needs, but they both need certain kinds of help.
Sure. And what was it like during the lockdowns for you? Were you able to, did you or your husband stay home to work, or did you need extra help while, did the boys have remote schooling?
This is such good questions. And it's funny, I was just talking with my husband yesterday about how that seems like it was so long ago. But
Right.
probably like a lot of people, March 2020, both my younger son and my older son came home from school for ostensibly a 2-week break. And
Right.
my older son received a packet of papers, worksheets, various things in the mail that we were supposed
Oh,
to
okay.
complete. And then my younger son, he was in middle school at the time, pivoted directly to Zoom classes. And nobody really knew how to use Zoom for
Sure.
effective instruction at the beginning, and people learned quickly. So I'll just focus on my younger son for a moment. My
Mhm.
younger son has a 1-to-1 aide at school. At that time, he did it. Now he currently needs less support, thankfully. And he also had some speech therapy and other kinds of services and supports at school. So what happened was I became his 1-to-1 aide,
Oh, sure.
because although technically his 1-to-1 aide was on the Zooms with us, she wasn't here in our home where Sam was doing his schoolwork. And so her ability to help, although she wanted to and was sincerely trying, was limited. You know,
Sure.
someone's just a little square on a screen and they're telling you, like, are you on the right page? It's really not very effective. So what ended up
Mhm.
happening was I sat down next to Sam and helped
Mhm.
him to keep focused, because not only did he need help at school under the most ideal of circumstances, at home, looking at a computer screen and in a completely different environment, he needed much more, much
Of
more.
course, yeah.
And so it became a big part of my day to help him. And we got
Mhm.
through it, but it was tough. It was very tough. My older son also began Zooming after several weeks, when we all kind of realized that this was not
And this
just
was
going
going
to
to be,
be,
yeah,
yeah, like a
yeah.
couple weeks. And my older son, because of his disabilities, had physical therapy, occupational therapy, speech therapy,
Mhm.
and a lot of adapted activities. And so my husband and I, as well as Sean's nurse, became his in-person therapists and teachers. And so when it came time for PT, we were on the floor helping Sean. The PT was telling us what to do, and it required a lot of time and investment from both my husband and me, and our nurse. My son had a nurse, and still does, for his feedings, for various things he needed medically. So between the three of us, we kind of got it done. It was not the most graceful process, and my goals really for myself were to keep myself calm and focused so that I could help them and not to get flustered, because I could hear, sadly, sometimes people's parents yelling at them through the Zoom. And out of frustration. I don't mean that in any way. I had my moments too where I had to walk away and because it's hard, it's hard. And so we got through it. Specifically for me and my husband, we have a business from home. We do market research from home. And so we were already accustomed to being in the house together and working from home. And what we had to do was modify our hours so that we could be available during the core Zoom hours of our kids. And then so we got up early and did work. We stayed up late and did our work. And honestly, I don't know how, but it all worked out somehow. Maybe because our clients were also at home, and so I could hear people. I could hear people who were on the Zooms kind of yelling at their kids, like, "Get down from there!"
Of course,
And it became, in a way, sort of humanizing. Do you know? To hear people.
We're all in this together, kind of.
Yes. And so the other things I did personally, and this is going to sound very elementary, but it worked for us. People were always asking me things like, what are we having for dinner? What are we going to do today? And I sometimes didn't know. I'm like, I don't know. What are we going to have for dinner? Because I don't know. I have to go to the store. So I went down to our basement and I got a preschool easel, that had like the write-on wipe-off board on one side, chalkboard. And every day I got up and I said, like, today is Tuesday, March 20th. The weather is sunny and it's 60 degrees, and we have Zoom school today, and we're having chicken and vegetables for dinner, and we're going to go for a walk tonight. And I just put the facts of our day, and I always note about, that I love being their mom. I loved that you guys are the best, and I'm proud of you. And I put a little note on there, and we all used it, and it just sort of made things have a framework. And although it was simple, and I got very creative, I got all kinds of markers, and we decorated it, and sometimes my kids make one, and I posted some of them on Facebook, just from day to day, just so people could see what we were doing, and I like looking back at them.
So I wish I had known you then. I know I understand you're saying it seems like an obvious, simple thing to do, but some little thing to just hold on to, I think at the beginning would have helped a lot of parents. So I hope a lot of people got, took your ideas, and it helped, it would have helped everybody, ground everybody, kind of set a tone and make it seem like, oh, this is the way it is, and we'll get through it.
That was great. Thank you. And there were some friends who got one too, and I just used what I had. That we all had to just use what we had. I had that downstairs. And then you know what? It came back out when my older son graduated from high school, and it came back out because we would use it to make like a little celebration board. But the thing it also did for me is it helped me focus on the important parts of our day. And a lot of my task at this time was psychological, like to keep myself oriented toward what we needed to do so that I could be a support to my family. And it was something I needed to do. And it also helped me. So so that's just one idea. But the other thing that was different about us, because my older son especially had very substantial medical needs. We stayed home after school opened again. So
Okay, sure. Yeah.
Sean went back to school in May of 2021. And Sam, my younger son, went back to school in June of 2021. He only went for maybe 4 or 5 days because I wanted him to have at least some time as an eighth grader
Oh,
in the
right,
school
right.
building, you know?
Mhm.
So in a way, he got through middle school with, he was in school from September to March of 2020, and then a couple of days at the end of 2021, but most of his middle school time was at home,
Mhm.
sitting
Of
right where
course.
I am, at my desk.
Right, right.
So
Yeah,
um
right. Yeah. And that was good that he had some kind of like closing piece,
yes,
you know,
and
to
I'm
explain
so
it.
sorry, I'm just going to
No,
turn
it's
my
okay.
phone off.
Sure.
There we go.
No
Although
problem.
I'm not going to turn it off.
Okay.
Hold on one second.
Sure, no problem.
This is a new phone for us, and I don't know how to silence the ringer. I'm just going to let
No,
it ring
that's
on through. So I'm sorry about
it's
that.
okay. No,
Um,
this is meant to be casual, conversational, much better, I think, than, writing out formal answers to
I
the
agree.
questions. I think we can get more out of this. Um, Now you mentioned that your older son had a nurse that was
Mhm.
thankfully able to help you in person, but was there ever any concern about, I assume the nurse would then just go home every night or
Yeah. So she was
um,
here. She was here, I think, from about 9 o'clock to about 3 o'clock most
okay.
days. She was a new nurse to us, and
Oh, wow.
as it works out, she was just the right person to have here.
Oh,
And
wow.
we all wore masks at the beginning, and then she continued to wear a mask after we were
Sure.
comfortable without wearing them. But
Mhm.
we really took seriously the, staying away from
Okay.
people,
Yeah.
wearing a
Mhm.
mask, washing our hands a lot, and we fortunately did not get ill. Well, just very
Okay.
recently, we all caught COVID, but we got
Yeah.
through the whole worst part of it. And our nurse was the same. She was very fastidious about her um, her precautions.
Oh,
And
good.
we had had another nurse before that at the very beginning of the pandemic who was not that way. And she
Oh, wow.
and she made a point. This was before there was a vaccine, and she said,
Right.
"Oh, I'm not going to get that vaccine when it's available."
Oh,
And I understand people have their points of view about that, but that was not okay with us because we
sure.
were
Sure.
definitely going to get it, and we did. But
Okay.
we had just the right nurse. She came here every day. She went home in the afternoon. And really, had it not been for her, I don't know how we would have gotten through everything, because both Sean and my younger son needed um, one-on-one help,
Of course.
during
Of
with their
course.
schoolwork. So with three
Right.
people here, we could do it, and then my husband could work when I, at least some during the day. So
Mhm.
but we got it done. I'm
Yeah.
proud of us, actually. I
Amazing. Of
I
course. Yes,
we got it
you
done.
should be.
It was a
That was a
big
lot.
challenge for our family. I mean, it
Mhm.
it was among the biggest ones that we have faced, that the whole world just
Oh,
turned
of
upside down,
course.
and none of us knew when it was
Hopefully
going
it's
to end.
the biggest thing any of us will ever have to face, hopefully.
I hope so.
Yeah.
I
Yeah.
hope.
And now I'm assuming, did you have, you know, more specific concerns about your older son, with immunity or the vaccines? Was he more susceptible, for example, to anything, or, more
Yes,
sensitive
and
to?
most definitely. And we, um, for someone who has a neurologic disorder like cerebral palsy, or a lot of other kinds of disorders, if somebody had asthma, which my sons
Yeah.
thankfully don't have, but Sean was definitely in a risk group,
Right.
for
Right.
at risk for a severe um, um, COVID episode if he were to catch COVID. Um, and so we were especially concerned for him.
Mm.
And I was very focused on getting him a vaccine as soon as I possibly could. And at the time the pandemic started, he was 16. And
Mm.
so he could only
Oh,
have the Pfizer vaccine, which really limited us. But we were able to drive to Morristown, which
oh,
is
wow.
kind of far away. Not Morristown, Morristown. It was a good hour and a half away.
Oh,
And I was able,
MOOR,
yeah,
Morristown.
yes.
Yeah, down
We
south
had to,
there.
for people at in those early days, had to go to a super center, a vaccine super
That's
center,
right.
if
Yeah.
they needed to get the Pfizer vaccine. And so we were able to get him vaccinated early. I can't remember, but it was as early as we possibly could. We drove over, we got it done. And my younger son was 14 at the time, so he could not get a vaccine at all. You had to at least be 16. Um, and I have to tell you, the day that Sean got his second vaccine was one of the happiest days of my life. I felt so relieved. And I was concerned about any of us catching COVID, but I was so concerned about him catching
Of course. Yeah.
COVID specifically because
Yeah.
was at a higher likelihood to have a real crisis, because of it.
Hmm.
So
Right.
um,
Right.
I also reached out to the ombudsman for the state of New Jersey to try to
Okay.
get help,
Paul
like,
Aronson.
yes, Paul Aronson,
Hmm.
and explained our situation. And he got all kinds of people to help me find. That's how we ended
Oh,
up in
great.
Morristown, because
Great.
they said you need to go to a super center. I didn't
Yeah.
know that at the time, but his assistants probably allowed Sean to get vaccinated several months earlier because we were
Hmm.
willing to drive. So that we were very concerned, and we had a few friends from Sean's school who did catch COVID, and it was pretty disastrous in those early
Oh,
days.
wow.
They
Mhm.
survived, but it was scary. It's scary.
Yeah,
So
on top of everything else, all of the restrictions about just seeing your kid in the hospital, on top of the actual, risks of their catching the COVID, then your ability to help them was also pretty limited. That was just as frightening, I think, to
oh,
me.
I had one friend, and I won't mention their names for confidentiality, but her daughter caught COVID very early on, and she just stayed with her in the hospital for, it was
Mm.
like 45 days. She could not leave
Oh,
the
wow.
room. There was a shower in the room. It was a hospital room, thankfully, with a shower, but people had to bring her bags of clothes and, like,
Oh, yeah. Mhm.
food, and they got through it, but she couldn't go in or out. She had to
No,
stay in
yeah.
there. And but we all followed her on Facebook. It was a nightmare. And
Oh, I
they
can
were all
imagine.
praying for her, and her daughter survived, but that was tough. It was
Right,
tough.
right. It would be, yeah. So, when you brought your son to Morristown, did the rest of you then also get the vaccine at the same time?
No, we couldn't because Sean was in a special risk group at that
Okay.
time. No, we all had to wait longer.
Uh,
I can tell you this, I don't have the specific dates in front of me, but I can tell you that
mm,
each one of us, on the day that we could get vaccinated, we did. Um, I, my husband and I got vaccines at Summit Medical Group because we were both patients at Summit Medical
mhm.
Group, and they offered a clinic, and I got on the phone. First of all, you could not even get through on the phone.
No,
You could
right,
just get a
right.
busy signal, but I finally got through on the phone after trying all day. I held for an hour and 45 minutes. It went past 5 o'clock. I
Yeah,
saw their hours, stopped at 5 o'clock, and I thought, they're not even going to answer this phone call. It's just going to drop. But
yeah.
somebody did, and they got an appointment for me, and they got an appointment for Neil. And I hung up and breathed a sigh of relief. And then later on that night, we got an email from Summit Medical Group saying we're full.
Yeah.
We shut our phone. And I'm so glad I
Wow.
held, because I don't
Wow.
know. I mean, eventually, now, if you want a vaccine, you can get it, but at that time,
Right.
you couldn't. And so I was grateful that I was able to get through and get our appointment scheduled because it was just open that one day, because it filled up so fast.
Oh, that's amazing. Yeah.
So then we all got boosted. We all need to get the next booster now, the bivalent booster, I guess it is. But we got through everything until September of this year, and then I caught COVID. My husband, no, my younger son, no, my younger son never caught it. I caught COVID. My husband caught it, and then Sean caught it. But at that point, we had been vaccinated. It was a milder variant, and although it was not fun, it was not the same thing as feeling like your life might be.
Oh, sure.
So we still need to get the next vaccine, so our next booster. Yeah.
And how do you feel about your the opportunities you have for getting the next one? Are you just waiting?
It's funny.
Is it not available, or?
I need to just look into it. So I'll tell you what happened. This is we all caught COVID. It was a good 6 weeks before I felt like myself again. Like I was acutely ill for 3 or 4 days, but then I was tired. And so I thought, I need to get the flu vaccine first, because now I've had COVID. So I'm going to get the flu vaccine as soon as I feel well enough. And then we all caught the flu, all 4 of us. And so now, and that was in November around Thanksgiving, which was awful. And so now I need to get the COVID vaccine, and then the flu vaccine probably too. I don't know, but it was just funny. We spent a lot of the fall not feeling very well, and I think partially because when people went back to school, there's a lot. We were all wearing masks for so long, and so now I think our immune systems are out of practice, with having to fight things off. But thankfully that's behind us now, but that was not easy. But so really the reason I waited was I wanted to wait until I felt strong and well, and then we got sick again. And so now we gotta
cycle.
So now we've got to get I need to look into it. So I feel like we can now. So
okay, good. I hate not to brag, but we were fortunate because my son's school arranged for, they said if for parents who were interested, they arranged to have like a clinic to get the vaccine for the students.
Oh, that's so nice.
And not just, the fact that it was available was fine, but also they arranged it so that we could keep the kid in the car, roll down the window and stick their arm out. And they had staff available because not all of the students in his school would tolerate that, and there were some cars where there was a lot of shaking going on ahead of us, and big strong teachers rushing, but they got it done. And he's also been able to get both boosters through their program. So, and it seems like, well, if they could do it, why isn't every special needs school or regular school having that, even if it's just a regional thing? And I understand the beginning would have been hard with the logistics, but that's something that maybe in the future would be a big help. And my husband and I were able to get it because I remember going through the list of when you were saying you weren't eligible for it yet. Because we were technically caretakers for our son, we could claim that we were the same as, say, a nursing home employee. And, so that's how we were able to get, it's not like we're jumping the line. Like, you have to do what you have to do. My husband and I both have some underlying medical conditions too. And so we were able to go earlier than typical people our age. And right.
I really think that for people who are caregivers or people who have a medical condition, that is not only okay, to get the
Yeah.
vaccine. It's your obligation because I would be more likely to get really ill than someone else. So,
Right, right.
but I remember those days and thinking about it. Now you just roll on down to the CVS or the Walgreens and you can
Exactly.
get one. It's so
Exactly.
easy. But in the beginning, it was very hard.
Sure.
And I learned how to for my younger son, when he could finally get vaccinated, I scheduled with him on the state website, and I
Mhm.
learned all kinds of tricks. Check at 12:01 a.m. because they open the
Wow.
appointments up
Oh,
for
yeah.
the, and so
Yeah.
you had to, and you could see them getting grabbed because other people knew how to do that too, but we all helped each other to
Hmm.
learn how to use these website scheduling things so that you could actually get an appointment when
Yeah.
now
Yeah.
it's so easy,
Hmm.
it's so
Hmm.
easy.
Yeah. And I do remember feeling like you have to, right. When you say tricks, that's exactly what it was.
Hmm.
Um, and with my son's intellectual disability more than anything else, that was our concern, is that, he's not going to be aware of distances or masking or, touching things and then putting them to his face. But that was not one of the early, categories where he could have gotten an early vaccine. We had to, before it was offered in his school, he was able to, he was able to get approval to get a vaccine because of obesity. And I'm like, well, yeah, that's also, yeah, so it's like you
I'll
had to
take
play games.
it.
And then a lot of us were saying, well, if you were a smoker, you could get it right away. But if you had any other kind, so it's like, well, let's pretend we smoke, or whatever, just to try to get,
No,
so that I understand it. It couldn't have been easy to come up with these priorities. Right?
it's
Um,
hard, and also there were kind of two groups of people like us who were clamoring to get a vaccine as soon as
yeah,
we could, and other people who had no intention of getting
yeah.
one or felt distrustful of the whole vaccine um, issue. It's so funny. I'd forgotten, now that we're talking about that, I'd forgotten about how difficult that was at the beginning because
Mm,
it was really tough.
yeah, yeah.
So, and I'm grateful that we were able to get them. I'm grateful you were able to get them too, and your family. We all have to do the
Hmm.
best we can to protect ourselves, you know.
Sure,
Um,
sure.
Another factor for Sean was Sean having saliva, like he drools
Oh,
as part
okay.
of his disability. He can't really even wear a mask for very long. So
Oh, I see.
because
Oh,
they get
yeah,
wet and then they don't work, you know.
yeah.
So when Sean gets allergy shots, so when he would go to the allergist, we would have to just make do and make that mask work the best we could for the time
Oh,
he was
right.
in there.
Hmm.
And I had asked them, can his nurse is certified to give injections, and
Oh, okay.
can she do it? And they said no. If he has an anaphylactic reaction, you have to
Oh,
be
I
somewhere
see.
where. But
Mm,
I mean, I understand their points, but some things were really hard to do, for
right,
quite a
right.
while. But
Yeah, a
we
lot of
just
those conditions, yeah, that kind of fall through the cracks. Yeah.
yes, yes.
Hmm. Now you also mentioned that the second type of reaction was just no way am I getting the vaccines at all.
Mhm.
Did you ever have any issues with, let's say, therapists, teachers, or any other staff who did not get the vaccine and maybe you were uncomfortable interacting with?
Well, um, yes, they, and also friends. And,
Friends, of course, right?
we have friends from all walks of life, all different perspectives. And when you have a kind of a diverse group of people in your life, they have different opinions about things. So
Hmm.
there
Yeah.
were a few friends who just said we don't we think that's harmful. those vaccines are harmful. So we would talk with them outside. I didn't even, I mean, I know it sounds awful, but I would not even have them in our house because
No, can't blame you.
and not out of not wanting to see them. We would set up our chairs in the, in the front yard and sit outside. And we had a couple of nurses who came to interview and said that they were not vaccinated. And you know what? That was a no-go for us because it's better not to have that help than to have someone potentially bringing a problem in. And so, yes, there were a few people. Most of the people that we know were so comfortable, if not enthusiastic, vaccine receivers, if you will. And then there were a few people who weren't. And I understand there are people who mistrust the government or feel that the science is not valid. I don't know, but it really, it's sad to me because I think if you can't trust your government or scientists, who are you going to be able to trust, So I am glad not to have been burdened with those kinds of ideas myself. I just feel that we have to do the best we can. Yes, there actually have been some COVID vaccine issues that came up. I know for women with their monthly cycles and things like that. So it's not that they are completely free of side effects. It's just a decision, between a risk of getting COVID versus a risk of having a side effect. So it's not, to me, there was not much to think about. It was very clearly more
not
beneficial.
a hard decision.
No, not at all. Not at all. But we do have friends and professionals in our lives who did not believe the vaccines were helpful, necessary, or even some people thought they were some sort of government plot. I mean, and and so, everyone gets to make their decision, I guess, but I get to also decide not to be close to people who I feel could be harmful to our family, So.
Yeah, it's tough to be in the middle like that, but you do, I mean, obviously your priority is keeping especially your guys safe.
Yeah, and during the times that when the vaccine was not approved, below the age of 16, I also think that we have an obligation to children and young people who can't get the vaccine yet, or there are people who have autoimmune disorders or other kinds of conditions and they cannot be vaccinated. So part of what I felt I was doing was helping to protect children and individuals who couldn't get the vaccine by myself getting it,
That's right. That's like second order thinking that, people don't go to that extent. It's like, I'm making this decision for me. I don't care about anybody else, but you do have to, your decisions affect the rest of the community. That's right.
And I will tell you that our few friends who did not get vaccinated are bright people, critical thinkers. It was baffling to me. It's not as if they weren't capable of thinking this issue through. They just really didn't believe in it and felt it was hard. So you can't even really convince people to do it often. So
did you have any, when you looked at the guiding questions, did you have any suggestions for what the state could have done differently or other local community organizations that could have helped, especially our the population?
I really think that and I hope we never have to be in a situation like this again, but I do think that if there's a way to involve schools, especially schools for people with disabilities on a broader scale or as a state policy, that would be so helpful. Number two, I don't know if there were many of these, I didn't see them, but like short public service announcements from people who were vaccinated to say, I got my COVID vaccine to protect myself and my son who has a disability, you know, for example, like
Right,
kind
right.
of more so that people could see faces and hear the voices of people if they were on the fence about it, you know, that had decided to get vaccinated.
Mhm.
In Essex County, our county commissioner, Joe DiVincenzo, was so he was on, you know, had recorded messages about the COVID vaccination sites, encouraging people to get vaccinated. I don't know if every county commissioner did that, but I think that as
Interesting.
much of um, as much as possible, because he's a trusted figure in, you know, in our county, and
Okay.
so if there are people who are in government who are um, trusted, popular, well liked,
Mm,
that they can talk about these things too. I think at the beginning of everything, there was just a lot of uncertainty, and truly, these vaccines were new and they were tested, but it is
yeah.
true that sometimes side effects become apparent after a large number of people have been vaccinated.
Right, right.
So I think that that might have helped to uptake of the vaccine, if there was more voices sharing that they had been vaccinated.
Mhm. Okay, that's good. And that could be used in other public health
Oh
issues.
yeah,
Yeah, that's a good idea to put relatable faces to it.
yeah, and even now, this year the flu is much higher in
Oh,
prevalence.
right,
Some of these
yeah.
things could be applied to other. I mean, the flu vaccine is a different story in some ways because it's so well
Mm.
known and well characterized. But there are still people who don't get the flu vaccine, or
No, yeah.
and there are people who can't get it, and so the same message applies that you can protect yourself and protect others.